Now it is my pleasure to ask our panelists for this morning to introduce themselves. Dr. Faisal, why don't we start with you?
Hi, good morning, Lynn. Thank you very much to the organizers for having me today. My name is Faisal Izwan. I'm a public health doctor by training, and currently I'm the Deputy Director for Non-Communicable Diseases under the Disease Control Division of Ministry of Health in Malaysia. In my current role, I am responsible for policy and strategic planning for non-communicable diseases for the country. Over to my fellow panelists.
Good morning, everyone. Hello, my name is Eric Wong. I'm the Chief Customer and Marketing Officer for Prudential Assurance Malaysia Berhad. It's a pleasure to be here this morning. Part of my role is really partnering our customer to get healthier and wealthier, as health is the ultimate wealth, right? And my other role, which is very important, is to help our customer prepare themselves for medical emergencies. And we'll be talking a lot about some of these preparedness that you can actually exercise. And with that, I just want to pass over to the next panelist.
Thank you so much, Eric. I cannot agree more. Health is wealth indeed. Hi, everyone. Good morning. My name is Maggie Wong, and I was a former radio announcer and a TV host, MC, also a fitness coach, and also the founder of Motion Lab, which is a fitness studio focusing on small group classes and personal training as well.
All right. And of course, my name is Lynn, and I'll be your moderator for this morning. Now, as we are all adjusting into the new normal that COVID-19 has presented us with, we're beginning to see some of the lasting effects of the pandemic appear on our global economic and healthcare systems. So today we're here to explore the shifts in behavior on the health culture of Malaysians. For the purposes of this discussion, we're going to be using the Malaysian Health Survey that Mittal made reference to as a benchmark for pre-MCO behavior and attitudes. So our discussion will span three main health culture changes: usage of digital healthcare, financial preparedness for medical or health emergencies, as well as personal health and lifestyle. So onto the first topic, which is digital healthcare. I mean, one of the clearest shifts in behavior that we're seeing in comparison to the survey is that people are relying more on digital healthcare apps and services post-MCO. So the Malaysian Health Survey found that 75% of the Malaysians surveyed had never used an online doctor consultation before, and of these respondents, 69% preferred to see a doctor in person. 22% weren't even aware that there was such a service. So Dr. Faisal, perhaps you could elaborate on this. What are the trends that you are seeing today in how Malaysians are interacting with the healthcare industry?
Thanks, Lynn. Before I comment on the actual findings, perhaps we should look at the behavior of Malaysians, the health-seeking behavior of Malaysians pre-COVID. We did a population-based survey, which is called the National Health and Morbidity Survey, NHMS, in 2019, looking specifically, firstly, at NCD risk factors, and secondly, looking at the utilization of healthcare services by Malaysians. So I'd like to talk first about the health-seeking behavior for Malaysians in terms of screening for health. We advocate it is important for Malaysians to undergo health screening. Unfortunately, NHMS 2019 have shown that of the Malaysians who have high blood sugar, only 1 in 2 know they have high blood sugar. So that means they have already high blood sugar. They are basically undiagnosed because they never underwent health screening. Almost 1 in 2 do not know they have high blood pressure. The screening that SOCSO provides for the contributors upon reaching the years 40 years old, only 20%, slightly above 20% have used their screening vouchers, and this is provided for free. You can undergo screening for free in a lot of private clinics, private GPs. NHMS also shows that almost 3 in 4 women aged 40 years old never had a mammogram. 1 in 2 women 18 years and above do not conduct breast self-examination. So this data shows that Malaysians are not getting themselves screened despite knowing, despite availability of such services. So that's just screening. And we are seeing the consequences of that now and in the future. When we talk about seeking behavior when they are ill, so NHMS 2019 also showed that during the period of the survey, 1 in 5 Malaysians rated themselves as being poor health, not well. And in the past 2 weeks prior to the survey, 1 in 12 of adult Malaysians actually seek treatment in an outpatient facility. And out of these, 40% is actually aged 60 years and above. And of those seeking treatment in health clinics, 70% actually go there because of the current health issues, right? About 37% is for your regular checkups. That means they already have perhaps diabetes, hypertension, and about 27% go there because of medical checkups, which will include health screening. Of course, this doesn't add up to 100% because you can go to a health facility for various issues altogether. And if you talk about a Malaysian feeling ill, the NHMS 2019 also showed that about 60% would prefer getting the information from a healthcare provider, so which would be slightly consistent to the Malaysian Health Survey, which found that 69% see a doctor in person. However, we also know that about 23% Malaysians self-medicate, which is not a good thing. 16.4% seek advice from family members and friends, and I'm sure we know people like this, and 11% seek advice from the internet or social media. So, so Dr. Google, I assume. So these are the behavior of Malaysians prior to COVID-19, and any discussion going further with the impact of COVID-19 and the MCO will be going through the, the baseline, and then you would appreciate what kind of which Malaysian will actually continue to seek treatment from doctors.
So, Dr. Faisal, what about from the hospital perspective as well? We've talked about the fact that COVID-19 has accelerated digitization trends across a variety of industries. So what kind of telehealth services have you seen start to crop up in hospitals, and has this trend accelerated with COVID-19 in the picture?
Yes, I would agree with you. That's one of the positive co-benefit of the MCO, COVID-19, this acceleration of the use of digital health. I'm just going to use the term digital health to encompass everything. From the provider side, right? Currently, our policy, regulatory ecosystem doesn't really support the development of telemedicine per se when it comes to consultation, but COVID-19 has accelerated that acceptance, that the need for us to have the proper regulatory. In fact, during this COVID-19 period, what the Malaysian Medical Council has done is they have issued a temporary guideline enabling healthcare providers to use telemedicine. So that has prompted providers providing such services both in the clinic and also at the secondary care level hospitals. However, that only looks from the perspective of providers. See, you can provide, but whether people will utilize, that's why I brought up the issue about the behavior of Malaysians in terms of health seeking. Doesn't mean it's there that you will use it. Doesn't mean it's there that people who do not really seek treatment from healthcare providers will want to change their behavior. It certainly will assist those who are already engaging well with healthcare providers, definitely.
So, Eric, I'd also like your perspective on this issue. From Prudential perspective, how has Malaysians' behavior changed as a result of the movement control order and COVID-19?
Yeah, thank you, Lynn, for the question. So before I get into sort of during MCO what we've actually been noticing, I just want to say that the ambition for Prudential is really to partner with all Malaysians in their health journey. I said earlier about health being the ultimate wealth. And with this ambition, Prudential has launched an app called PulsebyPrudential. And a lot of the statistics that I will be talking about is actually coming off our observation from the PulsebyPrudential app. So to start off with, totally agree with Dr. Faisal on the need for Malaysians now to really care for their health and well-being. And this is the reason why we've actually launched the app in August last year. And to date, we've already amassed 1.37 million downloads, which is good news. So Malaysians are taking action. They're going into this AI-powered app to get more information. And in the last few months, starting from March, We have also seen that about 500,000 additional downloads for the app has actually taken place. And within the app, the offerings within the app allow the users, which are all Malaysians, Prudential customers or not, to really experience a few things. Number one is the health assessment. So there is actually an online health assessment that you can perform. There is also a symptom checker. So a little bit like what Dr. Faisal said about Dr. Google, but this is actually powered by our partner, Babylon Health, where we look at symptoms that our users are experiencing and really giving some guidance around what they can do with that. We also have a dengue prediction functionality within the app, as dengue is still very much an ongoing problem in our country. And last but not least, we touch on a little bit about the teleconsultation, i.e. online doctor. We also have that functionality. Now, what we've experienced during the MCO period is that we've got pickup for each of these functionality. I have to say it's pretty nascent in Malaysia still. We're starting Malaysians to get used to getting help through these resources, and that's really the aim. Our ambition is really for more Malaysians to make use of the functionality within the app, and what we're seeing is there is a trend of increase in usage, but that's really still a very small percentage. And what I'd like to encourage all Malaysians to do is to really get on to a lot of these resources that are available, not just by PulsebyPrudential, but generally across the board.
So, Eric, the other thing about Malaysians is generally that Malaysians are not particularly prepared for any kind of health emergencies, it would appear, because from the 2019 National Health and Morbidity Survey, which Dr. Faisal referenced, 46% of Malaysians, so nearly half the population, didn't have any form of supplementary financial coverage for their healthcare needs and relied on existing tax-funded healthcare coverage. Similarly, the Malaysian Health Survey also found that 1 in 4 of their respondents would need to rely on family or friends if it came to a sudden medical emergency. So could you talk to us a little bit about how perhaps this has changed with COVID-19? Have Malaysians' attitudes towards insurance, for example, shifted from what you've seen?
I just want to address the statement that you made, and I think it is true that actually the elements of protection is not nearly there. Actually, I think Malaysians are still pretty far away from kind of looking at potentially protecting themselves in the case of medical emergency. So before the COVID-19 period, we found that actually medical insurance, while already popular, the uptake is still has got a lot of room for additional uptake by Malaysians, and the reasons for this are kind of threefold. One is medical insurance provided also by employers, and a lot of us think that, okay, so since it's provided by the employer, then maybe we don't have to supplement that or get additional coverage. So that's one reason. The second one is the reliance on perhaps the public health utilities or facilities, and that's great because obviously that's provided for all Malaysians, but oftentimes you need to also consider other types of insurance, for example, critical or serious illness coverage as well, which actually tend to help you not just from a medical point of view, but when you have a situation where you may not be income during the period where you're seeking treatment, that's when it comes in handy. Now, I want to focus the discussion on during COVID-19. We've already seen a lot of interest in insurance coverage. We saw and observed that our website traffic has increased. There's a lot more the seeking of knowledge within insurance, which is a good thing, because I think we need to partner with our customers and our would-be customer alike to make sure that they have the right information when purchasing or considering to purchase a plan within their sort of gambit of financial tools, of which insurance is a big part. And so during this period, the website traffic has increased, and obviously the seeking of information also comes through our agents. We have 20,000 agents in Malaysia, and that's where often there's also a big source of information. And we also work with our bank partners. We've also seen an increase in the inquiries of our bank partners as well, which is a good thing. So that's a good starting point. And the customers often are also kind of asking questions around additional coverage that they might need to consider amid COVID-19 pandemic. So in short, we've seen an increase in inquiries and for people to find out more about the kind of coverage that they need, particularly during this period.
It's encouraging to hear that more Malaysians are actually taking the step to increase their knowledge, because that's the first step to any kind of informed decision.